So here we have the pelvis. Okay, so we all know the basics. Yeah, it has three parts: the ilium, ischium, and the pubis. Okay. Now, other important landmarks in the pelvis bone are, the first one is the iliac crest, and that here is a superior structure here. Iliac crest. Okay, and in this diagram, an iliac crest. Okay. The next important feature we must know is the anterior superior iliac spine. So I'm circling it right now. The anterior superior iliac spine, and the anterior inferior iliac spine. Okay, so the anterior superior iliac spine, the anterior inferior iliac spine. Similarly, in the posterior view, I forgot to mention, this is the anterior view and this is the posterior view. The posterior view, we have similarly the posterior superior iliac spine. Okay. Next, this here is the ischium. Okay. So this structure here is the ischial spine, and you see this roughened portion here, that is the ischial tuberosity. Okay, so these are the basic stuff you need to know about the pelvis. And one more thing, you know, the structure where they meet, this is called the pubis, pubic, and the cartilage in between, this white cartilage you see is the pubic symphysis, and just lateral to that you see this tubercle, this is called the pubic tubercle. Okay, so this is the basic the basics of the pelvis bone. Now moving on, let's just begin with the the basics of the leg. Okay, so let me just get this out of the way. Okay, so the leg. Now we all know the leg has what? A thigh and the leg, or the lower limb has the thigh, leg, and the foot. Okay, now the thigh can be divided into three compartments. If this is medial, this is the lateral, we can divide the thigh into an anterior, posterior, and medial compartment. Okay, anterior, posterior, and the medial compartment. Then the leg can be divided into an anterior, posterior, and a lateral compartment. Okay, so in this discussion I'll be talking about each and every muscle present in each compartment of the thigh and the leg. Okay, you just need to know the names, but I've included the tables from your Vishram Singh textbook so that you can go through them right now and just have a brief idea. Okay, so let's begin with the anterior compartment of thigh. So in simple words, the anterior compartment of thigh has two muscles, the quadriceps femoris and the sartorius. Okay, now quadriceps femoris, the word quad means four, so it has four muscles. The four muscles are the rectus femoris, the three vastus muscles, vastus medialis, vastus intermedius, and the vastus lateralis. Okay, so the quadriceps femoris has four muscles, the rectus femoris and the three vastus muscles, and other than that we have the sartorius muscle. Okay, so these are the muscles in the anterior compartment of thigh. Now, and see, the origin insertion, as I told you, is not that important, but then for 1 mark questions they may ask, like the muscle that arises from the anterior superior iliac spine, or the muscle that arises from the anterior inferior iliac spine. So just remember, the anterior superior iliac spine gives rise to the sartorius muscle. Okay, anterior superior sartorius. Okay, and the anterior inferior gives rise to the rectus femoris. Okay, so this is all you need to know about the origin insertion. And the nerve supply, muscles in the anterior compartment of thigh is supplied by the femoral nerve. Okay, so anterior compartment of thigh, if someone asks you what is the nerve supply of the vastus medialis, just say femoral nerve. Okay, that's the basic. Now I've included the table. You can like pause the video right now and just have a brief read through of the origin insertion nerve supply. And actions of these muscles are not important, the individual actions are not important. When we study a joint, example the knee joint or the hip joint, like which muscles carry out a particular action of the joint, that's when we have to know the actions. So right now just knowing the names and nerve supply is enough. So we've discussed the anterior compartment. Moving on